introduce myself, I am Jessica Feldon. I'm the CEO of American Friends of Bar-Ilan University. I want to thank everybody for joining us today for today's webinar titled Meeting Israel's Public Health Challenges. We all know that the north, or the northern part of Israel, has faced years of instability, displacement, and security challenges, resulting in weaker healthcare system, weaker educational system, and higher unemployment than the national average. And that's before October 7th. The recent events have intensified those pressures and highlighted existing challenges. We all know that many people have left their homes and are debating actually whether to return or not. As we work towards stabilizing the North during this difficult period, we've partnered with the Russell Berrie Foundation on strengthening healthcare in the North. Years ago, the Israeli government understood that they needed to find a solution to the healthcare issues in the North. And they partnered with Bar-Ilan University, who made a conscious decision to become part of the solution. It's not easy opening up a medical school 3 hours from your main campus, which happens to be in Ramat Gan in Israel. But Bar-Ilan believed that the university has a responsibility to help solve some of Israel's most pressing challenges, and this is one of them. The university invested in research, healthcare innovation, an educated workforce, and community partnerships in order to make this happen. The medical school happens to be located in Tzfat, and it is a unifying place to find healthcare solutions. It's a place where all the different hospitals can come together all over the North, HMOs, the doctors, and community leaders to discuss, research, and come up with solutions to some of Israel's healthcare challenges in general, but specifically focused on the northern part of the country. It's part of Bar-Ilan's commitment to serve and help strengthen Israeli society. In fact, this year, the medical school graduated 150 new doctors. About 149 of them came to graduation with their white coat ceremonies. One was not able to come. He happened to be located in Gaza at the time. When the president, Ari Zaban, the president of Bar-Ilan, found out about this one particular student, he pulled some strings and was able to send over the white coat, the diploma, and the cap and gown, kind of smuggled, if you want to use that word, into Gaza, where his commander actually presented him, and his whole battalion had a white coat ceremony and a graduation ceremony so he would not feel like he was left behind. I want to thank the Russell Berrie Foundation for taking a serious leadership role and becoming a thought partner in this endeavor. Together, we've created something called the Russell Berrie Galilee Diabetes Sphere Project, and we call it Sphere for short. It's helping to focus on solutions for a diabetes epidemic that was out of control in the past, but finding solutions for diabetes in the North, and I'm sure Sivan will enlighten us with some statistics, but it helped us all also build a system to address some public health challenges. Today's discussion explores an important question. How can this crisis become a catalyst for long-term transformation? Rebuilding the North is more than just restoring the North to where it was before October 7th. It's actually an opportunity to strengthen healthcare systems, expand access, and create innovative models to help serve the local communities. The Sphere is an example of this approach, this very innovative approach. It brings together researchers and clinicians and educators and people from the community to focus on solving the diabetes epidemic. It helps address a major public health challenge while building long-term resilience in the region. On that note, I want to introduce our two guest speakers. I want to introduce Dr. Sivan Spitzer, who serves as the Deputy Director of the Russell Berrie Galilee Diabetes Sphere Project, and Dr. Idana Goldberg, CEO of the Russell Berrie Foundation. Just know that you have a Q&A box on the bottom of your screen. Any questions you have, you can put in that Q&A box, and we've left time at the end of the Zoom to answer some questions and have some Q&A. If we don't get to your question, we hope to be able to answer it after the Zoom call. We'll hopefully have a dialogue back and forth for those who actually ask specific questions. So with that, I'm going to turn it over to our two guest speakers, Dr. Spitzer and Dr. Goldberg. Bye.
Great. Thank you so much, Jessica. It's really my honor and the Berrie Foundation's honor to partner with Bar-Ilan on this incredible initiative. First, I just want to say, sort of hot off the presses, that Sivan Spitzer has recently been named the director of the Russell Berrie Galilee Diabetes Sphere in recognition of all of her work in the past 4 or 5 years to get this off the ground. And I'm very excited to be in conversation with her today. So just a moment about what makes the diabetes sphere unique. It is a center that bridges between academic medical research and community health interventions. And it's organized across a full diabetes pathway with pillars of prevent diabetes, control diabetes, care for diabetics, and also efforts at a cure. And it's a model that is based on partnership between the university and the community around it. And as we'll talk about now, we'll learn how this is implemented in this moment. So Sivan, can you talk about why in this time of prolonged conflict in Israel, especially in the north, why has this exacerbated public health challenges? And kind of what does this moment mean for the north?
So I think it's important to give maybe a little bit of background of, what is the north of Israel in terms of its health status, and why are we talking about, Jessica mentioned earlier, a diabetes epidemic. So maybe just to give a little bit of a background of what the north of Israel looks like. In terms of distance from the center of the country, it's only about 2 hours away. So if we compare it to the US or to Canada in terms of geographic disparities or rural communities, it really isn't that much of a case. However, we're talking about a population of about 1.5 million residents, about of whom 58% are Arab. The rest are of Jewish communities. And we'll touch a little bit about the Arab population and the differences. It's not a homogeneous population, so there's a lot of differences between the Jewish and the Arab population. But this is a geographic and social periphery. If we look at unemployment rates, if we look at the social status of residents living in the north, but also if we look at the health status of residents. So within 2 hours of distance from the center of the country, we're talking about 3 years less in lifespan. We're talking about 2-folds in diabetes patients. Within the Arab population, we know that about 50% of the population, of the Arab population over 65, suffers from type 2 diabetes today. So imagine if about 58% of the residents of the north are Arab, what does it mean in terms of the diabetes epidemic? We also know that, so I talked about a little bit about, quality. I talked a little bit about, longevity, but quality of life, if we look at it. So we're talking about higher chronic illness, not just diabetes. We're talking about obesity rates. 40% of children in 7th grade in towns like Tzfat or Sakhnin being overweight and obesity. These are our next diabetic patients, our next cardiovascular patients. So when we're talking about, and this is all data that was pre-October 7th, so we're talking about major health disparities, and then comes a war. to a region, to a social geographic periphery that has, suffered quite a bit of challenges up to the war. This is not the first time the North has spent in the war. A lot of times, we looked at October 7th and we looked at what was happening in the South. But actually, this is not the first time residents of the North have suffered the consequences of war. The Second Lebanon War, just in 2006, had major implication in terms of trauma and health outcomes. And then the war broke out after October 7th in the North as much as it did the horrific events we experienced in the South. And this had a detrimental effect. Not because if I had to kind of give an analogy, if we were at minus 100 to begin with in terms of the health statistics, now we are talking about the onset of war. We know, for example, that in evacuees, so people living in the North who moved to the center of the country, we saw 50% of them spiraling out of control in their chronic disease, mainly diabetes. We saw a reduction in screening rates. So mammography screening, for example, halved. So not just the diabetes epidemic, but just to give you a little bit of what health status looks like in the North. So this really poses a major public health challenge of what do we do? So is it to bring it back to 100? Or actually, is this an opportunity to maybe look at the surrounding area and think, can we build back better? Can we create a different solution to this problem? And we'll touch a little bit about what it means to face these challenges and how can we create maybe a different model to address this, because it's not just a health system problem. It's much bigger than that.
Thank you, Sivan. So I hear that the ongoing conflict in the North has really exacerbated existing conditions. It has brought new traumas, new impact on the North. But I guess one of the questions I imagine people would want to understand is that Israel has state health insurance. And so shouldn't that mean that residents across the country have the same benefits, whether they're in the North or not? And as you just explained, we know that that's not the case. So can you talk a little bit about, maybe a little bit more about why that's so? And in that context, what has been the role of Bar-Ilan and Bar-Ilan Medical School in terms of addressing these disparities in the North?
So, it's a fair assumption that we would think that if there is national health insurance, then we wouldn't see these disparities. And Israel has had a national health insurance since 1995. So again, there's been enough time that we would think that, these disparities over time would at least minimize, maybe not disappear. And the coverage in terms of the basket service, right? Israel has a central basket in which medications and medical treatments are covered for the population. And that is the same for all populations. That includes, by the way, treatment for diabetes. And it's actually one of the best health baskets in the world in terms of what it includes. So the opportunities exist. But what we see is that our insurance card isn't enough. And that actually poses a big question of why that is. Why isn't insurance national insurance? And then we actually look at maybe some other structural issues. And it poses a bigger question that we have in medicine. What actually impacts our health outcomes? Is it our genetic code? Or maybe it's our zip code? And that's been an ongoing conversation, especially around research in disparities in health equity, but also clinical research. Because if we assume it's the genetic code, and if we assume it's genetics, and if it's the clinical, the clinical health system or the clinical outcomes only, then there's ways to go about it, right? And that should be maybe easier to solve. We have new medications coming out, we have new opportunities, so we wouldn't expect that. But when we think of it, the social determinants of health, meaning the people where they grow up, where they're born, where they grow up, where they work, where they age, having an impact, where your environment shapes your health outcomes and not just your insurance coverage, then we start to understand the why. So I'll give maybe an example to make it very concrete. So some of the recommendations, for example, for diabetes or some of the new medications out there are the GLP-1 drugs, maybe use a trade name so everyone can understand, or Ozempic, for example, right? So we have the big hype for obesity. It's used for diabetes care as well. When we look at access to care for diabetes patients in Israel, and we look and stratify the data, and this is new data that just came out, when we look at the stratification of the data by socioeconomic status, we would think that there would be a disparity. So meaning the lower socioeconomic status would probably acquire less or have less access to these new medications, but we actually don't see any difference. So the insurance means that the medication is available for everyone and they can access it. However, the outcomes aren't the same. We see spiraling out of control diabetes. So we have the medication, but something isn't working on the end of the clinical outcomes. So one question can be, well, maybe it's the physicians, right? Maybe we don't have enough physicians in the North. When we look at the rate of physicians per 1,000 residents in the North compared to the center of the country, so you have about 3 family physicians or 3 physicians per 1,000 residents in the North compared to almost twice as much in the center of the country. So that's one disparity. And when we look at what Bar-Ilan Faculty of Medicine is doing to actually address that disparity, so here we have, the Faculty of Medicine that is training physicians, future physicians in the North, but that's not enough. Because it's not only training the future physicians to reduce that gap, it's also thinking, well, if there's access to medications, but people aren't using it, what's happening? Why is that? And then it's a double coin. On one lens, we can say, well, people maybe don't understand their rights to acquire this medication. Maybe they don't know how to take it correctly. There's huge difficulties, and this is not only for the north of Israel, but there's huge difficulty in medication persistence, even of these new medications, especially in populations with low health literacy, which is very common around low socioeconomic status populations. But then there's also questions, do physicians know how to prescribe this direct to the patients at the right time to make sure that they're taking their medication? And this again is something where Bar-Ilan comes in. And this is actually being able to work with both. And this is something that's unique to the Faculty of Medicine and unique to Sphere. On the one hand, work with the communities themselves. Make sure that the people get the information they need to fulfill their health rights, make sure they know how to take the medication. And we've created a platform that allows them to have all of this information. So this is one example. On the other hand, it's also trained the physicians to make sure that they're prescribing the right medications to the patients who need them, that they have all of the most up-to-date information of what's going on, to make sure that we're able to achieve this pharmacoequity where the patients receive the medications they need at the right time. And this is as much as a problem of educating the family physicians out there, not just the endocrinologists, but the family physicians, so that we can reduce disparities. So that's one way to kind of look at, despite having national insurance, why we see these disparities and what Bar-Ilan is doing about it. The other thing is that when we put the health insurance card aside and when we put the coverage issue aside, that we see other major structural issues come up, and that's kind of the living environment, right? So a doctor may say, if you are suffering from obesity, or if you're suffering from diabetes, or if you're suffering from, cardiovascular disease, you need to create major lifestyle changes. So some of it can be very simple, like walking, the guidelines, the American Diabetes Association guidelines from reducing the transition from pre-diabetes to diabetes say you need to exercise 150 minutes per week and lose 5 to 7% of your weight. That doesn't sound like something that's impossible to do. But when you don't have the sidewalks, when you don't feel safe in walking, when you're living in a war zone, what are the solutions, the structural solutions in your environment that allow you to actually do this? So this creates the needs for thinking outside the box of how can you create models that address both the structural community issues as well as the clinical ones to really see how we can mitigate the disparities that we see despite having national coverage and insurance.
Well, thank you so much. And I think you've moved us towards actually, perhaps you can describe for us some of those interventions. And while you do so, I want to note that, as you mentioned before, more than 50% of the population in the North is an Arab or Druze communities, Bedouins, Druze, Arabs. And the impact of the war and also the impact of diabetes has been disproportionate on those communities. So I guess as you tell us about some of those interventions, can you also speak about how you're working with the Arab community along the way?
So I think, working in general with different communities, and in that sense, Sphere, through the work and the Faculty of Medicine in the North, really is a living lab. It's a huge sandbox to test different intervention of what works for whom and what situation and why, understanding the very differences between the populations. And even if we look at the Jewish population as well as the Arab population, as I said earlier, it's not homogenous. We can't work the same with residents living in Sfat who are ultra-Orthodox as residents living in Kiryat Shmone, who have very different life stories, very different communities, both heavily impacted by the war, but very different approaches. The same goes for the Arab community, working with the Druze community, working with the Muslim community. About 42% of the Galilee is Muslim, and then we have the Druze and the Christian communities that make up the rest of the population. But these are very, very different communities and how we can work with them. So one is being in the North, being part of these communities, being located means that we have a lot of, it's not only a living lab, but we have a lot of information and insight to what it means to work with these communities together. And it is also important to say that the Sphere staff is very diverse, not only in its professional background, but also in, we have a staff that comes from the Muslim population, the Christian population, the ultra-Orthodox population, the Jewish secular population. So really reflecting the Galilee in itself. I think it's important to understand what the war impacted, and I'll give a few examples of interventions in just a minute. But when we set out Sphere 5 years ago, war wasn't in the blueprint of what we envisioned to come. And when October 7th, when the Iron Swords War broke out, it was a question, do we plow on as per usual? Or do we attend to our partners? And when we look at the Sphere partners and ecosystem, so we have the Health Maintenance Organization or the health funds who mainly provide primary care to these communities. We have the hospitals. They were impacted, by the war, the ability to provide services, to open clinics. What does it mean when you have 150,000 residents evacuated, and now you need to provide services in hotels or in the center of the country, but their physician is in the north? So to help our, we understood very quickly within 1 or 2 days that we had to think, what can we do to support our partners? So on the clinical side, we opened together with our bringing in the best experts in terms of diabetes management care. We opened a hotline for family physicians so they can think of what to do and to provide care in these situations. We sent out together, again, with our HMO partners, teams to the different hotels to assist in giving coordinated care to patients who were evacuated from their homes in the north. That was one aspect. We also had guidebooks for what do you do or how can you assist your patients who are running in and out of the bomb shelter. What should they have in place in their bomb shelter? And we had a series of videos, both in Hebrew and in Arabic, so that physicians could send out to their patients. On the other hand, we were working with communities. And I would say that a lot of these communities did not have good enough data or understanding of what is the implications for health of their residents. What services are open? What services should be provided? How do we address, and I'm talking about municipalities as kind of the coordinating our organization of these communities. What can we do? So within a week, we set up an entire infrastructure with medical students where we collected the data for them and made it available. What is the infrastructure in terms of health in the shelters? Do they have defibrillators? Do they have first aid kits? What pharmacies are open and have safe rooms? What HMOs are open? Clinics are open and have safe rooms? What is provided in this situation? How many residents do they have with acute health conditions that they should be aware of? And we build an entire data infrastructure that is used to this day, so they can have the data to act. again, this is not a mandate of Sphere, but it's working within your community and your ecosystem to make sure that you are working with your partner's needs. And I think it's also a very important lesson to medical students of what is their role in the community when we have these types of crises. On the other hand, we are also launching ongoing interventions because we understand, and I talked a little bit about it before, that we need to create a better model of care, prevention, better control and management of chronic disease, and also thinking of how do we care for these patients. I'll touch maybe in this context a little bit less about the cure or the more, I would say, lab-based research. But within these intervention, it means that you have to create synergy where silos are present. So a health system doesn't know how to talk to community organizations per se. It's important, they understand the importance, but it's not always something that's, that they're able to reach. On the other hand, municipal services or municipalities or municipal government has no idea how to talk to the health system. They don't see health as an issue that's their agenda. So we've done a lot of interventions first to build this infrastructure and create a synergy where people are talking. That means that we provide the data. How does the clinical data match up with the community data so we understand the different clustering in different communities and how that impacts what's going on? Why do we see higher obesity rates in certain neighborhoods versus others? Why do we see more diabetic patients spiraling out of control in certain towns rather than others? How can we look at this community and clinical data together to have new insights? From there, develop interventions. So it could be interventions for example, to look at access to services. So we have a mobile unit that is actually operated both by the HMOs, by the primary care providers, as well as by the community. So it goes into the neighborhoods where we see the poorest control so that we can make sure that these patients are doing their annual checkups, eye exam, foot exams, blood work, right next to their home, all done in 1 hour. They don't have to go to different sites to get these exams done. And then we can think of how to do this. So this is one type of intervention. The other is also creating the connection in the community to make sure that health is on the agenda. Working with religious leaders, for example. So we've trained and we're working really across the region, training imams in mosques. Or the religious leaders of the Druze community in the Khilwe. So we are looking at or working with priests, working with rabbis. So working also with that and thinking how do we look at the wider region. But we've also looked at how can we prevent the onset of diabetes. And we know there's a window of opportunity. And we know that we can prevent the transition from pre-diabetes to diabetes in that window. But if I kind of look at everything I've described before and say, well, there's the health basket, we have the primary care services provided, it's still not enough. How can we connect the two? It's not rocket science per se, right? But how can we create the synergy between the place a person lives, the instructions or the services he gets from his primary care provider, and the services he gets from his community to enable the lifestyle change that's required, that we can stop that onset of diabetes. And by doing that, we've been able to show that by creating an intervention done with Maccabi Health Services, and it's now being implemented at scale across the Sphere towns, that we've been able to have the number of people that are transitioning from pre-diabetes to diabetes. So just by creating that synergy, that intervention has proved itself as being effective. And we've been able to do the comparison between Sphere towns who have that synergy to other towns. And we see that there is a difference a significant difference that we've been able to achieve by creating that synergy. So those are just a few examples of the interventions we're leading within the Sphere model.
Great. And I think what's also important about how Sphere operates is, as you're talking about these measurements, right, the interventions are sort of tracked towards the specific problem, but you're also then collecting that data so that you know what the impact has been. And I know some of the numbers in terms of looking at the conversions from a pre-diabetic to a diabetic have gone down in those areas, which is very important data for us and for you as you move forward. So you sort of mentioned, and as did Jessica, this idea that as the North hopefully is coming back from these moments, years of crisis, that it's not enough just to go back to where the North was, but that the North has to become better. So when you think about that day after and what that's going to look like from a public health perspective in the North, what do you see as some of the measures that we can and should be taking right now so that that longer term healthcare crisis can be mitigated and also addressed over time?
So I think it's looking at several pathways at the same time. I think one is seeing what is the necessary infrastructure to put in place and working at a policy level to make sure that we can build back better. So we have that infrastructure in place within communities, within the clinical, the different primary care providers or within the hospitals. So that's one aspect we've been doing a lot of work working. There's a government resolution that was passed 2 weeks ago on the rehabilitation of the North, where we've been working a lot with how does health come into that. So one is at the policy level and making sure that we have that infrastructure. But the other is also seeing the opportunity for new insights and new knowledge, given that we have this living lab that allows us to actually look at, I would say, the most forward-thinking models that are present, that are of importance not only to the North but internationally, and I think this is a really good opportunity. So I'll give a few examples of really interesting research that we're doing. So one is looking at the effect and impact of long-term war and long-term conflict on civilian society and its implications on chronic disease, whether it's PTSD, and we know there's an increase of almost 50% in PTSD in residents of the North. To give an example, we know there's a connection between PTSD, the onset of Alzheimer's disease, and diabetes, for example. So we're looking at how can we understand and take these issues really to the forefront and if what it means. And unfortunately, Israel is not the only country with prolonged conflict, but it allows us to really think forward of what is the groundbreaking science and then the interventions we can develop to deal with such issues. The other is thinking, well, we've endured this, prolonged war, but actually the inherent problems of patient engagement, patient adherence, patient persistence are ongoing regardless of the war. They've worsened, but how can we take this, again, this living lab, and think of what are the big questions going forward in terms of diabetes care? And this is where we're really working on a lot of research, big research grants, international grants, also with pharmaceutical companies, with international academic partners to think how can we improve patient engagement through different tailored opportunities? Is it telemedicine? Is it other interventions that can bring care better to these populations that are living in social or geographic peripheries? What can we do? So we are developing different types of digital therapeutics. Again, this is an international project that can address, for example, medication persistence in cardiovascular diabetes and obesity patients over time. So what we're doing in terms of building back better, it's looking at all of the advantages of working in the Galilee. And I think this is where we at least think of it not as a challenge, but actually as a benefit, as an advantage to be at the forefront and think of how can we, together with our partners, with our community, with the local healthcare system, create a national and even an international model of how to address these onset of ongoing problems. So that's a little bit of how we're looking at the opportunity of building back better. We think that, mitzvot tzedakah from the North, the Torah will, the how we do the manual for how to do this can come out.
So it's certainly a living laboratory at this moment.
So I think I have one question for you, Idana, as we kind of, we've been having this wonderful discussion, and I thought it would be interesting also to ask, why did the Russell Berrie Foundation support Sphere, and how does, supporting such an endeavor impact and resonate with the foundation's mission?
Sure. So the diabetes sphere for us came at an intersection of several of the foundation's priorities. One of them is diabetes care research. The foundation has invested for decades in diabetes from the experiences of our founder and his family. And so seeing an opportunity to make a real impact in diabetes care in this region where we knew the rates were disproportionate was an important moment for us. We also were among the original funders rather, of the Bar-Ilan Israeli Faculty of Medicine. And that for us came out of our attention to and investment in the north of Israel, which has been a priority for the foundation also for several decades. And as we've talked about, a percentage of Arabs and Jews in the north being almost even, for us meant that this was a place where if we can make things work in the north, perhaps, as you talked about, can be a model for the rest of the country. And as we've been saying, the disparities in the north, whether educational, employment, healthcare, have existed for a long time. And so for us, the ability to have an impact on those disparities through an institution that we care deeply about at Bar-Ilan, in the area of diabetes was extremely important. At the same time, and I don't know that we planned this when we first made this investment and worked on the planning process with you, among the most innovative aspects of Sphere's work has been work through the municipal level and working with local authorities and civil servants within local government in order to enact health. And for the Berrie Foundation, looking at the municipal level as an ability to impact quality of life is also something that has been a lever that we've been using, whether it's for economic development, whether it's for helping human capital. And at Sphere, under Sivan, your leadership and the leadership of Dr. Shakata, who preceded you, we've been able to use that municipality, use those positions that are in there to have an impact on the quality of life from a healthcare perspective. So Sphere really in many ways encompasses several of the foundation's priorities. And first and foremost is the safety, security, and health of the land and the country of Israel, which Sphere reflects in the way that it operates. So we're going to turn to some of the questions that you've put in the chat. As I look through them, I see that we've addressed, several of them in our conversation. So please feel free to add more, and they will share those with us. I guess one question here is about the community health aspect of Sphere's work. And Sivan, how do you try to make sure that the solutions that you are proposing from a policy level, from a research level, are actually aligning with the needs of the communities that you're working with?
Well, that's a great question. And I think, there's a I would say a goal or a motto we really try to live by in Sphere, and that is nothing about us without us. We do not think that we know what's best for the community. That is not our role. However, being an academic institution that's based within Northern Israel, we do the footwork. That means that when we work or we plan any intervention, it's done together with the partners on the ground, together with the community partners. It's not done for them. It's not done without them. And I'll also say that to be sustainable, this has to be done with the community. It has to meet the community needs for them to take ownership of this. At the end of the day, if we want this sustainable, the community has to take ownership of these interventions and run it without Sphere. I think that would be a testament to the success of this model. So that means that we spend time out in the field. I think there isn't a community that I don't know inwards and backwards when we go to work with it. It means that I know the staff, whether it's municipal staff, and I'm not just talking about me, this is of course the entire Sphere team, but we know the staff we're working with, we know the people we're working with. It's designed together with them and for them. We make sure that they create the contact within their local health ecosystem, whether it's the local clinics of the different HMOs or the hospitals. That's where Bar-Ilan is, and the Faculty of Medicine as an academic institution also has a lot of leverage. It can bring a lot of connections. We already work with the 6 affiliated hospitals. We work with the HMOs, the 4 HMOs in the region. So we're able to create those connections. But I think it's really important that the communities are active partners in this. And there's a lot of insights and lessons learned. And there's also been a lot of disappointment of, there's a disease I think we all fit, we all with doing interventions, we all suffer from projectitis. A project begins and then it's over and then, nothing is left. So coming or being very cognizant of that disappointment of over-promising and not delivering. So we do everything together. They're active partners. They are really with us hand in hand. And then you garner a lot of insights. What works? What doesn't? What kind of how do you tailor the intervention to meet a certain city that's different from another town or township or village? So it's really working hand in hand.
Thank you. Zooming out just a little bit, as we've kind of alluded to here, attracting physicians to the North has been a challenge. Can you talk about any of the initiatives that Bar-Ilan has been involved with or the government has been involved with to try to attract talent to live, work, and sort of serve the northern communities?
So yes, there's been actually a lot of work done both at the national level and by the faculty itself in Bar-Ilan. And I think this is really where Bar-Ilan is at the forefront, being the only faculty of medicine in northern Israel. I know there was one recently open in Haifa, but Haifa to me is not northern Israel. It's a little bit south, south to us. At the national level, the government of Israel has realized that we're going to be in a physician shortage very soon. And then if we don't invest in future generations of physicians, both in the north and the south of Israel, we'll have a problem, a major one. So there's different programs, leadership programs, like the Ilanot program, for example, that is done within the faculty, in which every year medical students are selected for this program. They apply and are selected. They go through quite grueling exams to be accepted to this program. And then the idea of the program and their commitment is to stay on as physicians in the North. So this is a leadership program that's been installed, and the faculty works hand in hand with the Ministry of Health. There's other programs like this that are now being instated for physicians who have already finished their medical degree, are in their first stages of choosing their path. So that's now, it's called Northern Stars. There's a similar one again in the South. And these are government programs looking ahead of how can we create the leadership in both the North and the South. The other thing that Bar-Ilan has done is actually open a 6-year medical program. So when the faculty was set up, it had a 4-year program, very much like the American programs, medical programs that we know. And that means that most of the students that would come in to do their MD program had already done their bachelor degree. A lot of them came also from the center. I teach population health at the faculty. This is the first course, day 1 of medical school. And I ask every year, where are you from? I ask the students. And what I saw predominantly in the first years was that the majority of students came from the center of the country. They were accepted. Medicine was their dream. They came. But it means that they come at a later age. And if they come at a later age, some of them already had families, they had spouses, and that very much dictated their ability to move north, because there were other, I would say that, there were other considerations of where would I practice. The faculty has opened a 6-year program. And I think that has been very important in impacting the ability to train students in the North who have grown up in the North. And we really see that within the 6-year program, that it's happened in the 4-year as well, but in the 6-year program, there has been a major shift that the majority of students are actually from the North. They come from the North, they stay, they finish their high school, their army service, if they're from the Jewish community, and they start their medical degree close to home. And this also is important because it means that these are, people who have grown up in the North, are from the North, their families are from the North, and the likelihood of them staying on after they're finished their medical training is much higher. So these are a little bit of the actions that are going on in terms of making sure that we are able to grow the number of physicians who are staying on in the North.
Great. So I think two parts of the same coin here. On the one hand, are there any misconceptions that you think people have about healthcare in the North? And at the same time, so what do you think that people would be surprised to learn about healthcare in the North?
I think the misconception is that healthcare in the North is worse than it is in the center of the country. And I think, that is a misconception because we only see the clinical outcomes and then we assume that healthcare is worse. There's been a major upgrade to all of the hospitals in the North, whether it's the Galilee Medical Center, whether it's Ziv Center, whether it's Poia, with really, Puglia has a leading cardiovascular unit in the North. For example, Ziv now has a treatment for cancer radiology that it didn't have. So there's a lot, and there's been major upgrade in the hospitals in the North. So I think that's kind of one misconception. I think what would be surprising, I don't know if it's as much a surprise, but I think, I would say that the North is very much patriotic to the North and thinking of how do we work together. And what we see more and more is that working together means that although there's competition, for example, between different healthcare providers, they know how to come and work together to drive health in the North forward. And that's very much also because, having a faculty of medicine that is able to partner with all of the different healthcare actors makes a difference. So I think that may be a surprise that even though some of these, organizations are often in competition, they know to work together very well, and they've made a lot of, efforts and kudos to them for all of the major work being done to make health better in the North.
Great. So are you seeing any interest in Sphere's model from other institutions or other communities in Israel? And how do you think about, I guess, Sphere's capacity or interest to move its model into other places other than?
So Sphere, was established in the North with very much the thought of how can we look at the North as a living lab and from that think how we can impact the North, but not only. And, as a scientist, as a researcher, the lessons learned are applicable far beyond just the North. We know this is already raising awareness in other areas of Israel, like in the Negev, in the south of the country, for example, where they have a lot of issues of disparities, some of them similar, some of them different or for different causes, but a lot of the structural issues, or there's a lot of similarities in the structural issues and how we address them. So that's one place where we see the opportunity for, I would say, both for partnerships, but also for cross-learning and the adaptability and acceptability of the Sphere model. And those are conversations that are already going on. Sphere's worked not only in the North, but it was also a major partner in reducing and establishing health infrastructure in Arab municipalities as part of government resolution 550 to reduce health disparities in the Arab community. And this was done not only in the North, but also in townships and villages, Arab villages that are also in the center of the country, and even I would say part of them a little bit in the south. Other than Israel, there's also international I would say awareness and also discussions around spheres acceptability and the model that we do in other countries like Denmark, for example. So Denmark, like Israel, has a national health coverage and national health insurance, but suffers from disparities, social geographic disparities. It's an interesting case because it's very similar also in when we talk about distances, for example, right? It's a small country. The working with the municipal lens, the ability to address disparities, and that model is very interesting to Denmark because health is provided or primary care is provided by municipal services. So this is where, but we also have international discussions about how sphere model can be applicable. And there's also, of course, other partnerships within research grants that we do with the European Union and others that have been interesting, or the sphere model has created interest and discussion across its applicability to other areas.
Sivan, is there a public health issue that you believe is not getting the attention that it currently should be receiving? Diabetes is a component of chronic health, but are there other ways that you're thinking about public health, especially as we talked about earlier in this moment after the war, that you think needs to sort of be paid more attention to?
So I would say, at least in terms of the Israeli context and after the war, there's a very, very bright lens on mental health. And that, of course, as a public health issue, just to give some numbers, we've seen an increase of about 400% in outreach to mental health services. So in that sense, that's something that's actually gotten a lot of attention. But what we don't see is getting attention are those chronic diseases that are prevalent, that are still there. And what we at least, foresee is that we're just at the tip of the iceberg. So, these patients who have not gotten care, have not managed their chronic disease, and this isn't just diabetes, over the past 3 years, we're going to feel that effect long after I would say we're back to normal or the war is over. And that is not actually getting maybe the attention. So in terms of a public health crisis, this is really to us at the forefront.
No. So one last question for you quickly before we kind of turn it back to Jessica. You're in the north, you are in Svat. Can you just tell us kind of how you are right now?
So I'm doing well, but I'm an optimist at heart. So I don't know if I'm the best person. But I think we are a resilient people. And, living in the North, we are very proud to live in the North. I've lived in, I've always lived in the North. I'm very proud to be from the North. There's a lot of, there's a lot of hardship or a lot of challenges in the past 3 years, but there are also very resilient people. And there's a lot of optimism and also a lot of sense of regional responsibility of making sure that we build back better the North. And this is not just in health. So I'm doing okay.
Thank you.
I want to thank Sivan and Idana very much and the Russell Berrie Foundation for joining us today. Sivan, I've heard you speak a few times, and every time I learn something new. So it's a pleasure. I just want to mention recovery requires more than rebuilding what existed before. And I think we covered part of that in our conversation. But just like the Sphere, which is a program that brings together varying parts and people of the North, the hospitals, the researchers, the clinicians, the Russell Berrie Foundation, we need to create more of these partnerships in order to focus on some of these complex public health challenges. Academia, healthcare providers, researchers, philanthropists, local community workers need to get together and kind of tackle and think about some of these issues, just like the Russell Berrie Foundation did a number of years ago and is having a direct impact on the North today. So with that, I want to thank everybody for joining us. If you have additional questions, you can send it to webinar@afbiu.org. Also know that this is live. This webinar was live on Facebook Live. You can forward it to somebody who you think might be interested. Just go to the American Friends of Bar-Ilan University's Facebook page, and you will find it there. Thank you very much, everybody, and thank you for joining us, and really thank you to our guests today.
Thank you.
Thank you.